We are not repealing the entire bill. There were actually some shared agreed upon premises between Republicans and Democrats in the bill, and so we've left those alone. What the referendum really is, and it's, first of all, it's about giving voters a chance to vote on what is otherwise a sales tax on their health care. I mean, if we hear all the time in the legislature, health care is a human right, and we believe that if it is, then we shouldn't be taxing it. That's not the way to make it more affordable. And so there are just 4 small sections of the bill that essentially repeal back $330 million of the entire package, not the entire package, and a provision of the bill which would allow insurance companies to pass this tax directly on to consumers. And we hear a lot of times in some of these tax fights, well, you know, corporations will just pass that on. This bill actually gave express permission for insurance corporations to pass the tax on. And so we find that objectionable, and we think voters should have a chance to vote.
The governor has said that the Medicaid funding package was the result of broad and bipartisan agreement after months of work, and it has broad support from the healthcare industry. You're asking for the governor to call for a special session. Do you think that's going to happen?
Well, I don't think it's going to happen. I think she said as much. And, you know, unfortunately, the governor is also running for office right now, and the Medicaid providers who support this tax, the for-profit Medicaid providers who support this tax, just gave the governor $60,000 for her reelection. So, and she came into the session saying passing these taxes was her #1 priority. We actually are not opposed to the idea of some kind of taxation to pay for Medicaid. And in fact, an alternative bill for Medicaid had a tobacco tax in it. We think that that's a more appropriate place to go and look for dollars for health care, is something that actually creates a health care cost, i.e. smoking. So I don't sort of buy what the governor's selling right there.
Well, let's talk about the referendum, because your critics say that you don't really have a clear replacement plan for this that would leave hundreds of thousands of Oregonians in the Oregon Health Plan who are covered under that expanded Medicaid in the lurch without anything. What is your plan for replacing it? Is the tobacco tax enough?
Well, I think that we have to first look at the fact that, you know, this week the governor's office was supposed to release data on how many people were ineligible for Medicaid. You might have read that story in the Oregonian. Thousands of people declared ineligible. Well, they're up to right now, last time I checked, 56,000 people who were either income or residency ineligible for Medicaid. That's $577 million of state and local revenue we don't believe we needed to raise to begin with. So we think, and starting right off, that House Bill 2391 was based on bad data from the Oregon Health Authority, and then we used those numbers to generate what we think we needed for a tax. We dispute that, and that's really what's at the center of this debate. The other interesting piece that's going to drive Medicaid eligibility downward is the state just raised the minimum wage. So in the metro area, if you were on Medicaid and you're a family of 2 and you now make $11.25 an hour, if you're working 40 hours, you're not qualified for Medicaid anymore. So that's another policy decision that sort of overlays on what is really the true need to fund Medicaid. You know, understand, Laurel, I grew up in the Medicaid system. We were poor growing up. I can remember when, you know, you got mailed a piece of paper every month from the, you know, state welfare office, and that's what you got to use to take to the doctor. I voted for the coordinated care organizations when we passed that law in 2011, and the very first bill I ever had signed into law by Governor Kitzhaber was a Medicaid expansion bill. So I'm not opposed to Medicaid. I am opposed to a taxation mechanism that is in the bill that we don't think is stable. We think that one of the taxes in the bill, which is a tax on the Medicaid providers themselves. So we're going to go tax Medicaid dollars and then use it to try to create another phony matchup to the federal government. We actually don't think that's going to pass muster with the federal government. We think this bill has problems.